When nurses deal with incivility, that's what we call it in nursing. So that could be sabotage or harm or eating your young or degrading other nurses, putting them down, making them feel inadequate. That's a serious safety issue. Let's imagine I'm an early career nurse, right? I'm a new grad nurse. I've been out of school for 6 months. I'm still learning, right? And I am doing the best that I can to implement my new practice. And the nurses are, mean to me, or they make fun of me if I ask questions, or I don't know how to do things. That results in nurses who don't ask for help. Right? I don't know how to use this piece of equipment, but I'm not going to ask because they're going to berate me. They're going to treat me bad. So I'm just going to try to figure it out. There are students out there who are terrified to ask their instructors for help or to tell them that they don't know something because they feel like they might get kicked out of nursing school, or they might get a bad grade, or they might be put on a contract because of that. That's a real safety problem for patients, because what you have is nurses who are scared to seek help, scared to have a dialogue, and make sure that we're providing the best possible care.
No one comes into nursing school knowing how to be a nurse. And even when you graduate, you get through your 4-year program, there's still so much to learn, because a lot of what you learned was in a textbook, or you had certain support while you were, getting your education. So it's like to me, it's like delivering a baby. I think about when I was in school, I always had someone there. But then when you're on your own, it still takes time to get that confidence to be built up. So there are some nurses, older nurses, who feel that I went through it, so this person has to go through it. So they purposely create challenges. They'll withhold information. It's almost like they're waiting for you to fail. And it's a lot of pressure on the nurse. And I'll give you an example of something that I saw when I was working on the unit. There was a new nurse, and the floor was very toxic, that no one was helping each other. They had cliques, they talked about each other. It was a mess. But this nurse was so afraid to ask for help that she tried to insert Foley into the patient's bladder, and she actually caused trauma to the patient. But it was because she was so afraid to ask for help. All she really wanted was someone to stand by her and say, okay, help guide her through. So when we do that, we're again building the stress, but we're also putting the patients in harm's way. And I don't know what happened to the nurse. I know that she was distraught over what happened, and she was blamed. Oh, you should have went for help. But the floor, from the leadership on the unit, already knew it was a toxic situation and still did not jump into help. But it's really just important to be there for the person and let them ask those questions that we consider are dumb, or you should know that. I hate when someone asks for help and they're like, don't you know that? I cannot stand that. But I think it's letting down so that that person could feel comfortable with any question that they'll be able to ask. I think that's really important, because I think to provide care, especially now, patients are more critical. Even working with pregnancy, we know that we're seeing a lot of complications. We know we're in a maternal health crisis. For us to be able to improve care, we have to work as a team. And I always feel like if you can't treat me with respect, how are you treating patients with respect? Because I should be your colleague, your teammate. I should be your partner in providing care. So if you can't respect me, if you can't listen to me, then how does that translate to the care you provide to patients who look like me?
The whole presentation came about because we had a lot of our tribal elders, a lot of our tribal citizens coming to us Native nurses with so many different issues that they had while they were in the healthcare facility. They felt like they were being discriminated against, or the nurses didn't understand them about their medicine, what they needed while they were in the hospital, or even having a song sang for them. And so as a nurse, I thought, okay, how can I help with this situation? So I wanted to do a cultural awareness education just to provide for our nursing staff. And I went to my nursing supervisor at the time, who was white, and I explained to her, this is the situation and this is what I want to do to help, is to provide a cultural education awareness. And she told me, well, you're going to offend a lot of people. And she told me I shouldn't do it because it was going to be offensive. And I couldn't understand what she meant from that, because how is teaching about my culture and my people going to offend people? But as I shared the slide, the little post that I get, then that answered my question. It's because people are fearful of the things that they don't know or they don't understand. And if we just have that open-mindedness to be willing to walk through that door to understand, well, let's learn, let's figure out why this is happening instead of shutting everything down. Let's just get together and accept each other and understand each other. So that's kind of the story of how all of this got started, was because I was told no. I was the troublemaker.